All right, friends, it's Peggy Hall back with you again from thehealthyamerican.org. It looks like we are just about to go live. And let me know where you are tuning in from. Let's see. I think we are up and running. So, again, Peggy Hall from thehealthyamerican.org. There is ongoing ridiculous discrimination still happening in healthcare settings. I brought a story to you some weeks ago about a healthy American whose mom was rushed to the ER unconscious, and how until the day that she was released from the hospital, from the ER actually, because they would not admit her to the hospital, they hounded her to engage in the nasal Schwab assault, as I call it. And luckily, she stood strong. I'm going to be bringing you that interview in the coming weeks, but I have a story from the opposite situation where it's a healthcare worker who is continually being discriminated against, pressured. Wait until I tell you the story, how ridiculous it is, how she was able to work for several months without any discrimination, and just on some type of arbitrary date that the flu apparently is still going around. Let me share with you what she did. My advice, remember, I'm not an attorney, but this is simply education and information, and then wait until you hear what they came back with. This is important for you, whether or not you work in a healthcare setting. Perhaps you know someone who does, but the bigger picture is how the tyrants and the oppressors are still at it. So you're not going to want to miss this. I do want to thank everybody for being on board. And I have a message from the sponsor of today's show. And we are hopping right on over. Join me here at 3harmfulfoods.com/Peggy. And this is information and a free video from Dr. Amy Lee. She is a holistic medical doctor, and she says that we live in the most advanced era of human history with more medical breakthroughs than ever before, but still millions of Americans are unhealthy and overweight. So what gives? She says that one of the main reasons is that there are 3 harmful foods that are being passed off as so-called health foods in this country. So you can find out exactly what they are over at 3, that's the number 3, harmfulfoods.com/Peggy. I'll have a link for you in the description box below. She'll explain that these foods can cause weight gain, clog your digestive tract, deplete your energy, wreck your skin, and basically they're banned in other countries, but shockingly, they're still legal in the US. So it's time that someone shined a light on what they are, and that's what you're going to find out here. So she explains the side effects of these foods and how they're wreaking havoc on the health of millions of Americans. But you can reverse this, and again, find out exactly how to do it, 3harmfulfoods.com/Peggy. You'll be able to watch the video and find out exactly what to do, and then you can regain control over your body, and I'll give you a link in the description box below. All right, friends, I want to bring you this information on a case that I've been working on with a healthy American. And I want to thank all of you that have reached out to me for your help. You know, I've done thousands of videos about your rights and how to stand up for them, how to defend them, how to learn about the laws. And I know that there are plenty of lawbreakers, public serpents, as I call those, who have been selected to not represent us, as the case may be. But this is a situation in a private medical setting. And so many of you have had horror stories of loved ones that went in and didn't come out. So this is not a hospital, but this is one of those urgent clinics. And I wanted to bring you this story to let you know what's going on from the perspective of an employee and why I fight for this so diligently, because we don't want, as people that are going to seek medical care, we don't want to be discriminated against. We need individuals in these settings that are in favor of free breathers, that are in favor of standing up for your rights and not discriminating against you. So I'm going to share that with you. But before I do, I just want to bring you a quick note. Thank you from a healthy American, Raquel. And this just came in. And she said, "Dear Peggy," I'm just reading from my email here. "Thank you for your passion for truth and for encouraging your audience to learn to discern." Oh my gosh, friends, if that is what you can do and take away from my videos, I feel that my job is done, that is what I'm here for, to help you discern truth from deception, to dig deeper, to not get bamboozled, hoodwinked, and duped. So she says, "I found you in my quest to make sense of things 4 years ago. I found you, and I'm so thankful for that. Nothing made sense other than our country had just been taken over by very dark forces. Unfortunately, my family fell for the lies. Let me know in a comment below if that happened to you. She writes, nothing I presented to them helped to open their eyes to the lies. It has been very challenging to keep our family together. It is by the grace of God that we are together. She says, it continues to be a challenge. Your humor and good advice has helped me to refocus on what is going right and what I can do every day to keep the focus on the light and love. Love, being the most powerful force in the universe, gives me hope to go on and to know that we will prevail. It is taking time, but I know that the light is winning. Much love and prayers for you and your husband. Thank you for all you do. From Raquel. Thank you, Raquel. You're right. Love is what conquers all. I just got a new necklace that has the word love on it. I can't wait to wear it because it is a reminder to speak the truth in love. I know sometimes I get snarky. I flip my lid. I fly off the handle. I go on a rant, but I call that righteous anger, which is an expression of an emotion in the face of an injustice. So there are times when it definitely is needed. So what I want to do is tell you the story about a healthy American. And I'm just going to call her, no, I'll just call her Cheryl. And she asked for my help in our VIP membership program. If you're not aware of what that is, that's where you can get my one-to-one help. You get a phone call with me, you get unlimited email access. We help you with your situations. Mainly, we've been focusing on immigration cases, legal immigration cases, where people are getting their green card or their citizenship, and they're still being discriminated against to become a human pincushion, whereas they have a right of no consent based on their religious beliefs. We've had, I think, 100% success rate in that category. We've had a number of nursing students who were being discriminated against as well. And again, I don't have any case of anyone that has not been able to go through with their clinical studies. That's where they normally turn the screws, is after these students have gone through their classwork, and then they have to have their placement at a hospital or clinic. And then the school is telling them that they can't do it, whereas the clinics are required by law to accommodate them. So I know all the ins and outs. I know all the pitfalls. I've been doing this for years. And then the other category that we really work a lot in is people that are on the job or seeking a job. I have several videos already about what to do if you are a job applicant, because you have a right of no consent, and it is illegal for them not to interview you or not to hire you based on your medical status and based on your religious beliefs. So here's a situation where a woman has been working for years at this clinic, and I'll just summarize it for you, that she put in an exemption for the flu cocktail, and she also put in an exemption to not wear the suffocation device. So that has been with her HR department since November. And when she came to us for help, it was April. So somebody do the math for me. I think that's 5 months or more, that going on 6 months now, that she was working without any discrimination as an intake person at this clinic. And there were individuals coming in that were wearing the device. There were others that were breathing freely. And no one in her department, her supervisors, said anything. They didn't even blink when she showed up at work breathing oxygen in her pure blood state, because she put in for her religious exemption. Just as an aside, remember, when you are standing on your rights, when you are objecting based on your religious beliefs, you are not asking permission. You are notifying your employer that you do not object to these policies, because remember, they're not laws, and they certainly are not mandates. I've covered that many times. A mandate is not a law. It is an order from a court for you to do something. And until a judge orders you to suffocate yourself or become a human pincushion, you don't need to do so. And you can keep your job and the benefits. But here's where these employers get very slimy with their tactics, and they will try to put you on unpaid leave. So here's what happened. Somehow a list came out at the company, at the clinic, that it had the names of everybody that had not become a human pincushion for the flu, right? I call it flu mongering, when they're making you so afraid that you're going to die from this. And apparently some people do die from some of the complications. It's very tragic, just like it's tragic that people die from car accidents and other things, what have you. Everyone is going to die someday. And hopefully everyone here is going to have a long, healthy, prosperous life. But the fact is, there are conditions and restrictions in place, whereas you do not have to participate in any activity that you object to on ethical grounds, moral grounds, medical grounds, religious grounds. And in this case, on the religious grounds, you stick just to your religious beliefs. A simple way would be that, I prayed and God made it very clear that I'm not to participate in this. I worship him by breathing his breath of life. Part of my religious observance is to keep my body pure and to not participate in any medical interventions in the absence of illness or against my own desire. I mean, imagine if your employer had a policy whereby you had to donate a kidney in order to work there. I mean, how is that any different than imposing any other medical treatment? What if men had to be castrated? Well, apparently that's all the rage in California. But what if that was a requirement of your employer? I've used examples, non-medical examples, of your employer having a policy where you have to sleep with your boss. Well, it's ridiculous because it is against your beliefs. So you make a simple statement, and I've done many videos about that, but here's where I want to go with this video. So it's so strange because this individual worked for several months breathing oxygen. Clients came into the clinic, some of them breathing oxygen, some of them not. No issue was made out of anything until they saw the list of the employees that were not human pincushions. And they said, oh, by the way, flu season ends in May. So by this time, there were like 2 more weeks. So for the next 2 weeks, you have to wear the suffocation device when you come to work. And she's like, no, I don't. I already put in for my exemption and I've been working since November and no one has said anything to me. So what has changed between then and now? And they said, well, oh, this is far too difficult to understand and figure out. So we are going to ask you to go on paid time off until we can figure out your situation. Okay, step number 1, that's illegal. All of this activity at the workplace related to discrimination falls under a civil rights law called Title VII. And Title VII says that employees cannot be treated differently at all, period. Put anything you want to in that bucket of at all. You cannot be made to work elsewhere. You cannot be stripped of any privileges or rights or preferences. You cannot be denied a promotion. You cannot be told that you have to wear a yellow armband. That's what some of the employers were making people do. And I kid you not, wearing a yellow star on your badge to show that you were not a pincushion. This is all illegal. Making you take your paid time off when that could be used at your own discretion later, for example, going on a vacation or your own whatever you would like to do. Why should she be penalized for some type of administrative error on the side of the employer who for some reason didn't know her state? But even then, she cannot be treated any differently, not per se based on pincushion or not pincushion, but based on these are my religious beliefs and you cannot treat me any differently. That would be like making all of the Sikhs who wear a turban, they could only, and this was an actual case that went to a federal court where there was a bank teller, if I remember correctly, and the bank teller was wearing a turban, and some of the clients were very uncomfortable going to a window where there was someone wearing a turban because of all of the hoopla in the news, and they thought it was a terrorist and blah, 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 generalizations and stereotypes and talk about discrimination. This poor individual was being discriminated against for his religious belief, which required him to keep his hair in a turban. Now, having customers be worried about an employee is never grounds for this law to be violated. And I know that because the courts have stated that again and again and again and again. So that employee with the turban cannot be, vanquished to the back of the bank and never be in front of the customers again. That would be discrimination based on religion, and that employee would have been treated differently. It's exactly the same with this individual working at the clinic, checking people in. Now, it is true that she could ask, and she did, for some type of an accommodation. And it's possible that they would have put up, I don't know, plexiglass, or they would have made the clients stand 6 feet away, or whatever it is that would make them all comfortable with her non-pincushion status. So I want to share with you the strategy that I went over, because I do think it's pretty clever. And I know that you're here because you want to learn, and you want to dig deeper, and you want to discern, and you don't want to be bamboozled, and you want to develop your critical thinking skills. So let's think about the scenario. And I would like to ask you what you would do if you were this employee who was told, you have to go home, you can't come to work until we figured this all out. Now, first of all, that is unfair. So what I recommended is that she, in writing, let her employer know that that right there is a violation of Title VII. It is highly likely that no one at her clinic has any understanding of Title VII law. And I can say that with confidence because for the past 4 years, I have dealt with thousands and thousands of employers, and that's over at thehealthyamerican.org. Click on religious exemptions if you want to see a list of just a sampling of some of the agencies and employers that I've worked with. And I'm telling you that they're quite ignorant of the law, or they pretend that they're ignorant to try to bamboozle the employee and pull the wool over their eyes so that they can pressure and coerce them and intimidate them. And all of that is illegal. It's basically harassment. So to coerce them into becoming a human pincushion, that's no different than your boss harassing, intimidating, and pressuring you to sleep with him. It is no different at all, actually, because that is an unwanted imposition on your body. And all of this jazz is, these are unwanted impositions on your body. So that's why I like to use those rather shocking analogies to bring people back into the, facing the truth of, your employer does not have the right to do that unless you sign something in your employment contract that gives your employer the right to give you medical advice. And if you did, I would actually recant that. I would take that back and say, I'm going to change that employee and employment agreement. So here's what we did. First of all, you need to document everything. She needs to be able to document that she put in for her exemption back in November. She needs to document that she worked all of these months without any problems from her employer. Did they send her an email? Did they threaten her? Did they warn her previously? No, and no. You're going to collect all of this information, which becomes a record. And that becomes evidence if you need to go in front of the EEOC, which is the Equal Employment Opportunity Commission. And that is the agency, that's a federal agency, and every state has a state version. And that is the agency that receives complaints about this type of discrimination. Now, I know, just like my lawsuit with the county, the EEOC is turning a blind eye to many of these cases, but that doesn't mean that you shouldn't make the complaint. You need to, as a matter of fact, especially if you're going to sue, because you need to have demonstrated that you tried to work this out before going to court. So you document everything. You document any type of retaliation, harassment, any snide remarks, any way that you are being treated differently. And in this case, the woman is being put on basically paid time off. Now, I would want to make it clear, and this is what I recommend she say to her employer, that this is not coming out of her own banked time. This needs to be like an administrative leave because it's the fault of the employer that she's not showing up at work. It's nothing to do with her. She didn't ask for a vacation. And the fact that they're requiring her to use her own banked and earned time is another violation of the law. You can't treat anybody differently. It's so simple. That's why I really love the law and I love digging into this, because when you go at just the face of it, it's simple. And it's the bamboozlers that are trying to convolute everything to try to trip you up, to set a trap. And that's why I want everybody to avoid these pitfalls. Again, if you're on the other side and you're trying to get medical care, I've done so many videos on that. Check the playlist called Medical Rights. And yeah, you're going to need to spend some time educating yourself. Kind of cracks me up when people are like, I don't have time. Well, it's your life, and I hope you're going to make time for it. I spent hours and hours and hours researching it myself for you. So I hope you'll spend 20 minutes at least learning about it and watching the videos and learning about it. So you document everything. And here's the interesting thing in this scenario. At this clinic, there were plenty of visitors, right, of clients, of patients that were coming in, breathing oxygen, and they were purebloods. So there's discrimination again. How was that clinic able to accommodate the visitors, the clients, the patients who were breathing oxygen, who were not human pincushions, but they couldn't accommodate the employee? There's another case of discrimination. Also, it's highly recommended that you find the non-discrimination policy of this setting. So if you are even a patient or a visitor or a client and you're being discriminated against, you can go on the website of that hospital or clinic or doctor's office and find out their non-discrimination policy. That would be like saying, oh, no, we don't take any clients that are wearing turbans. Okay, that's so illegal. All right. There are laws that protect that. So you have to think outside the box and get their non-discrimination policy and point out to them where they are discriminating against you because of your religious belief. And if you don't have a religion, you don't need one. Everything just falls under that heading. Your ethical objection, your moral objection, all of that falls under the Title VII heading of religious objection, because religion is basically a set of, the government defines it as a set of principles that kind of an overarching way of living your life. And so if you can demonstrate that without saying, oh, these things were not tested, there's side effects, they don't work, that doesn't fall under that heading. That would open the door to some booby traps. So I don't recommend you do that. All of what I'm explaining and teaching here also can apply to the nursing students, to the immigration clients, and basically anyone. There are different laws that govern these different areas, but the principles are the same. You have a right of no consent. So here's what's interesting. In this setting, the HR never got back to the employee regarding her exemption statement. So she's been going along her merry way, working fine, until suddenly they realized she didn't play along with everyone else, and then she would be booted out. Now, it really troubles me. Think about the outlook and the attitude of the HR department. Here's what I think is at work. I think that they regret what they did in terms of becoming a human pincushion. And you know that expression, tit for tat? They didn't get off this requirement. They didn't know how to stand up for themselves. They didn't want to stand up for themselves. For whatever reason, they went along with it. And now they're like adolescents going, well, I had to do it, so do you. I had to do it. You do too. I believe that is what is at work at in a lot of these situations. They don't even want to think about the law. They don't even want to think rationally about this. It's just a knee-jerk reaction, or maybe they've suffered some brain damage, seriously, from the lack of oxygen and whatever problems they have in their body now from becoming a part of this experiment. So it's highly likely that their brain is not functioning as it should. We have to keep that in mind, that we're working with some, like mentally disabled individuals here. I've mentioned that before, where they wanted employees to get tested frequently in order to prove that they were healthy. Well, that's a mental illness. It's called hypochondria. And it's also called Munchausen's by proxy, where you think someone else is sick, and Munchausen's when you think you're sick and you don't have any symptoms. It's highly unlikely your doctor would give you a chest x-ray every week just because you think you have tuberculosis. He'd probably write you up for some psychiatric care because of hypochondria. Yet your employer was imposing this on you. You see, we just have to go back to reality. It's quite alarming that many people are not playing with a full deck there. So I want to go on a little bit. I'm looking at some of my notes here. So here's the story. They're telling her that the reason why now she has to wear the suffocation device is because of the health and safety of others. All right, here's where I think my response is very accurate, all right, and hard-hitting and irrefutable. So I recommended that she asked her HR department, first of all, that she agreed with them. Yes, you're right. It would be horrible if I was infecting people and I didn't know that. So I would like to have a list of all of the people that I have infected since November. I want to know exactly what they came down with. And I would like to know what treatments they received. And I would like to have their own personal information so I could send them a note, like a get well note and a letter of apology that I made them sick. Oh, and by the way, I'd like to have the evidence that you used to determine that I was the one that made them sick. And I would like to have that reviewed by a medical doctor who would stand up in a court of law and swear that I was the one that made them sick. And then I would like to know his methods of determining that, and that the individuals that you say I got sick did not get infected by someone else in their family or at work or at the grocery store or at the bank or maybe someone else in this medical setting. You see, friends, it's impossible to prove that. So this defense of you're a threat to others will not hold up in a reputable court of law. That's like saying, that's like you being in a parking lot and someone calling the cops and saying, I want you to arrest this person because she's a carjacker. And the cops come and handcuff you and haul you off and throw you in jail. Probably happens. I'm sure it does happen. And you're like, well, what's going on? Why? What's the evidence I was a carjacker? Well, you were in a parking lot with a lot of cars. So obviously you're a carjacker. You see, the reason I'm using this analogy is innocent until proven guilty, healthy until proven sick. And the next thing they'll do is they'll say, well, you have to get tested. Well, I already covered that. You don't get tested. That's hypochondria. And I'll do you one better. This is the accommodation. I will self-screen for symptoms of illness. And if I'm sick, I'll stay home. And here's the zinger of all. Staying home if I'm sick is safer than coming to work wearing the suffocation device. Now, they can't argue that. Well, they will try to argue that. And they'll say, well, you're sick and you don't have symptoms. Well, now we're going in a big circle again. So this whole concept of being sick without symptoms is falling apart rapidly. I spoke against it for years. And that is where they used that to pressure people to get the nasal swab assault to prove that they were healthy. There's no law that requires you to prove that you are healthy. And I'll go you one better. There's no law against being sick. You have a right to be sick. You even have a right to go to work while you're sick. In fact, if you had AIDS, they could not prevent you from going to work. This is where a lot of these laws came from, was in the AIDS scenario. In California, there's a law very much along the lines that I just explained to you, where if someone tries to blame someone else for their illness, you have to prove three things in the state of California. Number one, if I say, Mr. A got me sick, Mr. A had to know that he was sick. That's the first level of criteria. Number two, he had to willfully, intentionally try to make me sick. Do you know anybody that does that? And then number three, it had to be proven in a court of law that that's where the illness came from. It's impossible. So that came out of the AIDS era. AIDS, yes, just as deadly as cooties. Yeah, that's a topic for another day. So the fact is, it cannot be proven that you are a direct threat to the health and safety of someone else. And that these will have to be fought in court in certain ways, I believe, so that there can be more rulings coming out along these lines. If you even had this mystery disease called cooties, it would be discrimination if your employer did not let you work because you have a right to go to work. So this whole thing is so deep and messed up, and they painted themselves into a corner. Absolutely, they did. So the other thing that I recommended, I'm going to wrap up here, friends. The other thing that I recommended that this employee state is, because what you need to do is you state your objection, right? This is why I'm not participating. Number two, what can we do to accommodate me? So that might be that she temporarily would work at home. It needs to be something that the employee and the employer would agree to on a temporary basis, but certainly being sent home and having to use her own earned time is not equitable. Like, what about equity and diversity and inclusion? She's being excluded. So again, you use all of these policies against them. They want equity and inclusion. Well, okay, be equitable toward my religious beliefs. You see, I love it. They really painted themselves into a corner. So again, you want to ask, what is the detailed criteria used to determine that I'm a threat? Why am I a threat and no one else is? It doesn't. And aren't you all protected? You're telling me that I'm raining on your parade and you're all wearing raincoats. It doesn't even make sense. And then you also, I recommended that she also ask for any complaints or concerns raised by any of the visitors or any of the other coworkers. And how come it took so long? Why did they just wait until, 5 or 6 months later? And then again, a list of all of the people that she infected and what their illnesses were and if they recovered and how that was concluded. And then an explanation as to why that clinic was able to accommodate all of the other patients that were breathing oxygen, but they couldn't accommodate the employee. Doesn't make sense. And then I think it's important because a lot of these requests go in front of a panel or 2 or 3 HR employees. So I would ask this: who are the staffers that are reviewing my accommodation and exemption? Who are they? What training have they had in Title VII? How do I know that they understand the law that they're supposed to be adhering to? Who gave them that training? How long was the training? And what are their qualifications to judge my faith? And then this is the zinger. I would like to have a statement of faith for each of these individuals on the HR staff, because I don't know if they're anti-Christian or anti-Muslim or anti-Sikh or whatever religion the person may be professing. So you turn it around. It's called turning the tables on the tyrants. All right. And then I recommended that she put a time frame to get the response quickly, and also that any time off be put under an administrative leave whereby she does not have to use her own time off. So here's what usually happens, friends. Typically, there is a scenario where the employer is going to delay. They're going to run out the clock until flu season is over. And then they'll say, oh, guess what? You can come back because, on May 3rd, flu season is over. You've got to stay on top of them every step of the way. So those are my recommendations. I'm going to keep you posted on this. Remember, I want to help you in your situation. So let me know what you're struggling with. You can leave a comment here. And I do also want to let you know that starting next week, we are going to be doing a class all about life after loss. So many people have lost jobs. They've lost loved ones. They've lost faith in their country. They've had broken relationships, even with people that are still alive. They've had financial difficulties. There are so many things that we are grieving, and I want to help you through that. I've done a lot of grief counseling over my time. So if this is something that's of interest to you, you can email support@thehealthyamerican.org. We will get you on the list. This will be a private class going over a period of 4 weeks. And we want to help you. This will be private. There will be no censorship. And if you do want to come on screen to talk about what you're going through, we will be selecting a few individuals to participate that way. But basically, you'll be in the group and we will be able to offer moral support, spiritual support, and help you get through these difficult times. That's what I want to do. Focus on the positive, help you keep your head above the waves in these stormy seas of life. And remember, I am marching this all the way to heaven, and I'm so grateful that you are right alongside me. Thanks to the moderators. Thank you, everybody, for being on board, and I look forward to seeing you in tomorrow.